This video is going to demonstrate the respiratory exam skills. I will be talking through the demonstration as I'm performing the skills. I ask that you pay very close attention to the questions that I'm asking the patient, as well as follow along and grade me performing the skills so that you can familiarize yourself with the actual rubric and you'll have a good idea of how you would be graded should you have to perform this exam. I would have already done my vitals assessment as well as the patient interview and the med history, so I would have already washed my hands, so I'm just going to go directly into the skills demonstration. Okay, so I'm going to perform the pulmonary exam. I'm going to start out first just by looking at you, inspecting you overall. I'm looking at the color of your lips. If there's any bluing around the lips, I'm also going to look at the color of your hands, the tips of your fingers, as well as your nails. And I'm also going to assess clubbing, where I'm going to have you put your thumbs together like this. And I'm looking for a diamond shape, which would be normal. Okay, there's nothing there. Also just physically looking at the structure of your chest wall. I'm looking for symmetry. I'm looking for any masses. Also looking at the shape of your thorax. You know, is it at a normal shape or is it barrel shaped? I'm also looking at your work of breathing, looking at the use of accessory muscles as you breathe, and as well as the labored breathing if you would have any. So everything looks good there. Next, what I'm going to do is I'm going to palpate over a couple of areas. I am going to hover just to maintain modesty, which is what we would be doing in an OSCE, but in practice you would actually be touching the patient. So what I'm going to do is you just breathe normally. I'm going to just touch over some areas and I want you to tell me if you feel any pain or tenderness. Okay. So as I'm palpating, do you feel any pain or tenderness in those areas? No. Okay, all right, perfect. Next, what I'm going to do is I'm going to do chest expansion. So I just have you have your arms out to the side. Again, I'm hovering and I would mimic what I would be doing here, somewhere around the 9th or 10th rib. I would bring my hands together to a center point. I'm going to ask you to take a deep breath in and then exhale. So I'm actually showing that there should be a symmetrical rise and fall of the chest as that patient takes a deep breath in. So that's chest expansion. Next, what I'm going to do is tactile profundus. Again, you're just going to breathe normally in those same areas that I had palpated. As I put my hands there, I'm going to ask you to say 99. 99, 99, 99. Okay, so that's tactile profundus there. Next, what I'm going to do is I'm going to percuss in a couple areas. Now, you can do percussion a couple different ways. There's a two-finger or finger technique. So essentially, you would take your hands and using that second finger as the striking finger, you would place that on the patient's chest in those areas. I'm only going to hover in the anterior portion, so I'll demonstrate this a little bit better when we do it posteriorly, what I mean by that. You can use the reflex hammer to tap that strike finger, or you can actually use your finger to tap that area. Again, we'll demonstrate this a little bit closer in class, and there's also information in the PowerPoint presentation which helps show you how this is actually done. So I'm just going to percuss in several areas. You'll just breathe normally as I do this. So 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, and 6, 6. You'll see those areas on the PowerPoint slide as far as where they would be, but that just demonstrates the technique. Next, what I'm going to do is I'm going to listen to your breath sounds. So I'd ask that you would, as I place the stethoscope in those specific areas, I want you to take one full inspiration and expiration out, breathing in and out through your mouth, okay? If at any time you get tired, please just stop me and we can take a break, okay? So as I place it, you can just take that deep breath in. Okay? Yeah. Okay? Yeah. Okay, good. So that is the assessment of auscultation, so listening to the patient's breath sounds. Okay, now I'm going to do essentially the same thing posteriorly. So I'm going to ask that you swing your legs around to the back side. And again, I'm going to do my best to demonstrate this in the video, but in lab, you can certainly ask one of the instructors to show up close what some of these skills would actually look like. So again, starting at the beginning, I'm going to go ahead and inspect. Exteriorly, I'm inspecting the chest wall, looking for symmetry, looking for any masses or bulges in the area, looking at the shape of the thorax to see if there's any abnormalities noted there. Same thing that you would do anteriorly. Then I'm going to go ahead and palpate. So I'm going to palpate posteriorly. There's an extra area. So again, remembering anteriorly has one less area than posterior does. So posterior, again, I'm just going to palpate in several areas. Let me know if you feel any pain or tenderness. No, none, no, no. And it's okay for you to touch the patient posteriorly if you're comfortable doing that. And then next what I'm going to do is chest expansion. Again, the same thing. I'm going to take my hands along that 10th rib, bring my hands together. I'm going to ask the patient to take a deep breath in and then exhale. So you should see that symmetrical separation of the thumbs in that area. And then I'm going to go ahead and do tactile fremitus again as well. In this regard, just to show you tactile fremitus, you could be using that bony prominence at the palm of your hand or the base of your fingers, or you can actually turn your hands to the ulnar side. So I'm feeling for that vibration. Again, I'm going to tell you to say 99, 99, 99, 99, 99. Okay? So the vibration, you're likely going to feel it more up here versus down in this area, which is normal. You should feel somewhat of a vibration. And then I'm going to go ahead and perform percussion. I'm going to demonstrate it both ways, using the reflex hammer or just my hand. But essentially I want to rest that middle finger in that palpation area. So I can, rather than have my fingers spread up like this, I choose to actually put my hand on the patient's back. Using that reflex hammer, I'm going to tap. Should sound similar on both sides. Again, if I were to use my finger, I can do that too. I'm going to use my two fingers of my opposing hands. This is my striking finger, and I'm going to tap. Okay, so again, you're going to do it down 7 areas posteriorly. So this would be area 3, 4, 5, 6, 7 below the 6th area. Okay? Again, you can use a reflex hammer or you could use your finger, whichever technique you prefer. Next, I'm going to go ahead and auscultate in those 7 areas. So we're auscultating across 7 lung fields. So I'm listening for the sound across each field. So I don't want to go down, I want to go across, okay? So again, similar to what we did in the beginning, as you feel this placed on your back, just take a deep breath in, exhale out through your mouth, okay? Doing okay? Yep. Okay, next I'm going to demonstrate transmitted voice sounds. So I just want to listen a little bit closer in one area. What I'm going to ask you to do when I place the stethoscope there is just to say 99. You could also ask the patient to say E. Either one is fine, and you can just pick the spot that you want to actually listen to. Let's see here.
99,
You can do it again.
99.
Okay. So that sound should sound like a muffled sound, which would be normal. All right, so that concludes the respiratory exam. Again, in lab, you have the opportunity to practice these skills as well as ask one of the instructors for some additional assistance should you have any further questions. Thanks.